The only antidepressant which not affect weight gaining, the only antidepressant which increase dopamine and norepinephrine in the brain, the only antidepressant which used to make smoking cessation. Which one is Wellbutrin? This video we're gonna talk about Wellbutrin, chemical characters, uses, side effects, how to minimize side effects, drug interaction, drug food interaction, drug disease interactions, and I gonna answer the most frequent asking questions. Let's go. Wellbutrin, chemical characters, active ingredient named after Bupropion. Concentrations, it comes into two concentrations, 150 and 300 milligram. Forms, it comes in 4 forms: film coated tablets, sustained release tablet, extended release tablet, and tablet. Okay. T-half, the T-half for Wellbutrin XL is 24 hours. We have to take the second dose after 24 hours. Okay. Bioavailability, usually the bioavailability from brand is higher than the bioavailability from generics. Okay. Excretion completely excreted in the urine. Okay. Mechanism of action. Wellbutrin acts by 2 mechanisms of action. Number 1, dopamine norepinephrine reuptake inhibitors. Dopamine and norepinephrine reuptake inhibitors. It increases the amount of dopamine and norepinephrine in the brain. Okay. Number 2, competitive antagonist for nicotinic receptors. So it is used for smoking cessation or for quit smoking. Okay. Uses, the main uses for Wellbutrin is major depressive disorder, MDD. Major depressive disorder is characterized by person who suffering with depression and suicidal attack. It is the most serious stage of depression. Okay. Seasonal anxiety disorder. What means by seasonal? It is Anxiety comes from season to other. It comes from season to other. Okay. And number 3 is quitting smoking. Side effects. There are a lot of side effects for Wellbutrin, but I abbreviated them to 3 types of side effects on CNS, on central nervous systems, on weight, on heart. Okay. CNS, on central nervous system, it causes agitation, it causes insomnia and headache. Okay. On weight, the only antidepressant which cause weight loss. There is a study on 12 types from antidepressants. Number 1 not affecting weight gaining is Wellbutrin. The only one which cause weight loss is Wellbutrin. Okay. For some persons, this is not side effect. This is added value. Yeah, I want something to avoid weight gaining. I have depressions, but I have a fear of increasing weight if I used antidepressant like selective serotonin reuptake inhibitors or selective norepinephrine reuptake inhibitors or tricyclic antidepressants. The only solution in this case is Wellbutrin or Bupropion. For me, not side effects. It is added value. It is competitive value. Also, the last one from side effects, major side effect, is fast heart beat attacks. Yeah, it makes heart beats like boom, 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 like this. Okay. How to minimize side effects? For serious side effects like agitation and insomnia, the best solutions which should not affect or which should not cause drug-drug interactions from my point of view is melatonin. We have to take melatonin before sleeping by 2 hours and do not interact with Wellbutrin. And also I advise anyone who taking some medications contain Bupropion or Wellbutrin to take omega-3 fatty acids. For headache, I advise by something OTC medications like paracetamol. Weight loss, as I mentioned, it is not side effect. But if anyone is suffering from anorexia nervosa or any other eating disorders, I advise him or her to take something which contain vitamins, minerals, amino acids in the same a product, like for example Optimum Nutrition Serious Mass powder or Mastic powder from Muscle Tech company. Okay, it is supplements, so the sport nutrition, something like this, not affect at all or not interact with Wellbutrin. Fast heartbeats, the only solution from my point of view is to doing any cardio activity, any exercise, okay, especially aerobic exercise. Drug interactions or contraindications and drug disease interactions. Usually there are a lot of drug interactions, but I gathered for you the most frequent drug interactions with blood pressure medications, for example amlodipine, lisinopril, with also corticosteroids, especially prednisolone, with MAO inhibitors or monoamine oxidase medications, with benzodiazepines, with barbiturates. We have to avoid Wellbutrin with all of these medications. Also drug disease interactions, persons who suffering from seizures disorder, seizures like epilepsy, okay, eating disorders, especially anorexia nervosa. It is completely avoided with persons who suffering from eating disorders, okay, panic and phobias disorders. The final thing in this video, the most frequent asking questions, okay? This is the most important thing in my videos and the most important or the most added or competitive value in my video. Question number 1, doctor, I suffering from depression and anxiety. Can I take Wellbutrin? In my point of view, we have to avoid Wellbutrin with persons who suffering from anxiety, because it may increase anxiety, okay? The best question number 2, the best time to use it. From my point of view, the best time for using Wellbutrin in the start of your day after sleeping, okay, after awakening. Question number 3, the best to avoid weight gain. Is it the best to avoid weight gain? Yeah, it is the best at all. It is number one antidepressant which not cause weight gaining, in addition to it may cause weight loss, okay? Doctor, I suffered from bipolar disorder. Can I take Wellbutrin? Usually there are 2 types from bipolar type 2 and bipolar type 1. Bipolar type 2 who suffering from depression episodes more than manic episodes, okay? From my point of view, no problem for bipolar 2 persons suffering from depression episodes to take it, but you have to take another thing which make mood stabilizer or antipsychotic with Wellbutrin, usually under supervision of your psychiatrist, not from yourself, okay? But for bipolar 1, from my point of view, not recommended for bipolar 1 because it may motivate manic episodes. Okay. What about hair loss? To be honest, it causes hair thinning. Okay. I advise you to take some shampoo from high quality company like Fulton, like Vichy. These types of shampoo increase hair volume, and increase hair thickness. Okay. And also these types of shampoo not contain silicone, sodium lauryl sulfates, and others harmful ingredients for hair. Sexual desire. What about sexual desire? Yeah, usually almost all people who taking antidepressant suffering from low sexual desire. Okay, but with Wellbutrin there is no at all any deficiency in sexual desire. I agree. I totally guarantee this for you, and I gonna put all the researches and the studies in the description. Okay. Other solution for smoking. Yeah, there is another solution for smoking cessation called the medication called Champix. Okay, I'm gonna make a comprehensive video about it, inshallah, in the show. The last questions, doctor, is this medication always non-available? Yeah. Wellbutrin always non-available in Egyptian market, in Saudi market, in other markets, in all worldwide, not available, usually almost not available. Okay, the other solution is to take alternatives. I already forget to talk about alternatives. Here in Egypt, alternatives product called Wellenta, Vixadeb, Fomiban, Abstain. Okay, 4 products here in Egyptian market are alternatives for Wellbutrin. They contain alternatives which contain the same active ingredient. Okay, in Saudi market, Ziban. Okay. I already finished this video. I hope it is helpful and highly informative for you. Don't forget to subscribe in my channel. Don't forget to support us. Bye bye for now. See you.